So with this APOE gene, have you heard of it, Maz? It's an interesting one. As I said, it is involved in the metabolism of fats. And we know with genes, we get one from our mum, we get one from our dad. So interestingly, what they say, the research, is if you, with this genotype, because I said you get one from each parent. So if you have an APO2 and 2, what this means is you do better on a higher fat diet. But in saying that, not necessarily 70%. Okay, you haven't, no. So as I said, ketogenic diets can be 70-75% fat. So they're saying even if you have this APO22 gene, you do best on a higher fat diet, but it should only still be maximum 35% fat in your diet. And this shouldn't, because the thing is, with this genotype, you're not as affected by oxidized cholesterol in the same way that some of the other genotypes. If you're an APO4, these are the ones that they say you've got a much higher risk of Alzheimer's and things like that. You need to get your fat right down to 10% maximum of your diet, and it needs to be mainly plant-based. If you have an APOE3 and 4, this means that this is the most common. They reckon about 50 to 60% of the human population is this type. You can get away with doing anywhere between 15 to 25% of your diet can be fat. In saying that, we can look at the labs and check how you're going at, say, 15% or 20% or 25% total diet, having that fat content. And we do this by looking at things like inflammation, cholesterol, LDL cholesterol. So APO, so they're kind of the key things, but I just wanted to really highlight that because I said so many people are going in favor of these ketogenic diets. And this is what a lot of the research is showing. As I said, if this is a genotype that's involved in fat metabolism, and there's people that, really can't have more than 10%, and the most they could have is 30-35%, there's huge implications. I know someone actually who, when they were tested for this gene, and you can get tested in Australia, they found out that they were an APOE 4 and 4, which, as I said, means that they're a much, much higher risk of Alzheimer's and certain cardiovascular diseases and things like that. So they were doing ketogenic diet. So they've had to suddenly change it all and cut right back the fat. So anyway, it's just sort of something else to think about. But in terms of other fats, as I said, I just wanted to talk a little bit about, we've got omega-3s, we've got omega-6s. Not all fats are created equal. We know we've got unsaturated, we've got saturated fats. And I spoke the other day about, good fats like things like avocados. So we know avocados, they're really sort of healthy fat, bearing in mind only about a quarter is a serve. And we know this is rich in monounsaturated fats and also things like vitamin E and folate. So that's a good option. It is higher in histamines. If you're a histamine person, you do need to be a little bit conscious of that. Of course, then we've got things like butter and ghee, and for a long time people were anti that because of the saturated fats, and now they're realizing saturated fats can actually be healing in some forms and to a certain extent. So the butter and ghee, we know that, I always get organic butter and I do use it, not all the time, but it does help in terms of when you're having, steamed veggies and things like that. It actually helps you absorb some of those fat-soluble vitamins. And I also did an adrenal healing program earlier in the year, and ghee was one of the key elements that was used as a fat. So ghee also has the vitamin A and the vitamin E, which the butter also has the vitamin A and D as well. So as I said, those could be potentially healthy fats for you. Of course, we've got coconut oil. We know that, because of the medium chain fatty acids, that is a good option. And people talk about putting it on their hair until you put it on their skin. And the fatty acids have been shown to improve brain and memory function. Then the other night, when I spoke about extra virgin olive oil, and when you look at some of those populations where they do have longer health and more optimal health for longer, they do tend to be having a lot more of the extra virgin olive oil. So you're not really ideally meant to cook with it, but of course you can be using it for salad dressings and things like that. Then, of course, we've got the fatty fish. And I just wanted to talk a little bit about this because we've got the omega-3s and we've got the omega-6s. Most typical Westerners would have a diet higher in omega-6s. And this is what we get from, animal sources. We also get from nuts and seeds and those oils that tend to be in a lot of foods, like, the canola oils and the soybean oils. And they're very high in things like processed foods. So unfortunately, when we tend to be in favor of the omega-6s, this is when you do tend to see the rise in coronary heart disease, asthmas, cancers, neurodegenerative disease, and things like that. So we do need to definitely be upping our omega-3. And I spoke about that in another training with the omega-3 index, like that blood test. I see a lot of people, when I've done these bloods, that are deficient in omega-3s. So, you know, I was fortunately in the good range, so between the 8 and 12%, but I saw a lot of people in the 4 to 6%, which, you know, really suggests that they need to be upping their omega-3s. So with omega-3s, you probably hear there's ALA, which is the alpha-linolenic acid. That's more in the flax seeds and walnuts, things like that. And then you've got the EPA and DHA, which sort of you'll find rich in when you have something like fish oil. So the thing with the ALA, the problem with that is for our body to convert it and get the EPA and DHA, it's not that active a process. So that's why we do say it's probably better if you can have the omega-3 or have the fish oil capsules, things like that. So I also then wanted to touch on evening primrose oil, because evening primrose oil is omega-6. However, it's a different sort of omega-6 and it can actually be quite beneficial for people. So this has GLA, which is gamma-linolenic acid, and it's also got the LA. So where I would use evening primrose oil, generally for things like, I would say, breast pain. You know how people get breast pain and breast tenderness leading up to their period? That's when evening primrose oil can be indicated. I've also seen it used quite successfully for women that are going through menopause, for hot flushes and those hormonal imbalances. Also for skin conditions like eczema and things like that. And even the research does sort of show for arthritis, it can also be quite effective. So that's when I would sort of typically consider the evening primrose oil, as I said, for hormones. And there was actually, I had a randomized clinical trial sort of noted here where they said they looked at 56 menopausal women that were between the ages of 45 and 59. And they got them to take 2 lots of 500 milligram capsules of the EPO each day for a total of 6 weeks. And they found that in terms of hot flushes and things like that, it decreased the intensity and it decreased the interruption that those hot flushes had to their lives. Also, it can help for fertility. It can actually help increase cervical mucus, which we know is important, and that was usually using something like 500 milligrams 3 times a day. So that can also help, and they say if you're not getting the results after trying those 1500 milligrams, you can double your dose during your next cycle. So that's another time where you'd use the evening primrose oil. Acne, there can also be a time and a place for using the evening primrose oil, especially if there's a hormonal imbalance component. And then, as I said, in terms of eczema and things like that, the evening primrose oil can be a good option. So when we tend to go more for the omega-3, so this is where, and as I said, omega-3, so we'll be looking more at the fish oil. So we hear about fish oil and we hear about krill oil. So which one is better? So technically fish oil is higher in the EPA and DHA. And when you look at the research for the fish oil, for the EPA and DHA, it can help with things like PMS, difficult periods, breast pain, endometriosis. It can help with rheumatoid arthritis, Sjögren's syndrome. These are all autoimmune conditions, multiple sclerosis, eczema, asthma, psoriasis. It can also help with ADHD, anti-inflammatory, and IBS. So that's what some of the research can potentially show for some of these omega-3s and things like that. So the thing with the fish oil omega-3 as opposed to the krill oil is, as I said, fish oil is richer in EPA and DHA, but they say because of the phospholipids that are incorporated into the krill oil, it might actually be better absorbed. And the thing with krill is they say there's like 500 million tons, so the krill represent the largest biomass on Earth. So they say on average, less than 1/3 of 1% is harvested annually. So that means that krill is kind of meeting consumers' needs for many, many, many years ahead. Whereas as we know with the fish, not all are sustainably farmed. So that can be something you really need to look at. And also with the fish oil, unfortunately, they can have considerable amounts of toxins. So you really want to make sure the fish oil that you're using is very, very, very stringent with their testing. I know the one that we have at work, we are very stringent in terms of meeting local and international standards, because you want to make sure if you're having something every day, you don't want it to be laden with chemicals and toxins and, you know, some of those arsenics and things like that, which are going to cause a problem. So as I said, that's the fish oil and then the krill. So in terms of some of the research, they say that the omega-3, and I've actually got some clinical doses for you. For heart protection, you tend to go, can you take fish oil and krill oil together? You could potentially, but generally it's probably one or the other. You do sometimes see there's products in the market that have omega-3 and omega-6 and omega-9. There's products like that, and that can be sort of useful, but generally you don't necessarily have to take the krill oil and the fish oil together. But some of these things, so for heart protection, they generally say the fish oil, and you'd sort of generally do between 500 to 4,000 milligrams of the EPA and DHA per day. For arterial function and things like that, once again, the fish oil. For cardiovascular risk reduction, you'd go for the fish oil. For overweight people that are more sedentary, that have heart rate variability, once again, you could do the fish oil, and it's sort of higher doses. Where you're reducing risk factors for cardiovascular disease, the research has mainly been shown on the fish oil. For reducing triglycerides, some of the research has been really quite compelling for the krill oil use. And then for increasing your omega-3 index, so just say you get this blood test for the omega-3 and you're 4 to 6% instead of 8 to 12%, you could either do fish oil, the krill oil, both have been shown to be quite useful. And then in terms of cardiovascular risk factors when you've got type 2 diabetes, krill oil is shown to be quite useful. In terms of lowering lipids, lowering fats in the blood and anti-inflammatory, you could either do the krill or the fish oil. If you've had non-surgical back and neck pain, fish oil, generally between 1,200 milligrams or 2,400 milligrams, has been shown to be really useful. Osteoarthritis, you could do the fish oil, and chronic inflammation and arthritic symptoms could be fish oil or krill oil. So in terms of pregnancy, generally they've been shown more the fish oil. It's really important for cognitive function, allergy prevention, eye-hand coordination, neurological development, and healthy function in older adults as well. So generally, as I said, like both can sort of be quite useful, and also things like I was just saying here, difficult periods and PMS could be either krill oil or fish oil, or as we saw, even the evening primrose oil. Immune function, krill oil. Difficult periods, fish oil, evening primrose, or as I said, the krill. And upper respiratory tract infections in school children, they're actually saying the fish oil, but you could even do the cod liver oil as well, because we know cod liver oil is rich in vitamin A and D, so it can be quite useful during winter to boost your immune system. They do have kids ones on the market, and they do have adults ones on the market. So the other product I just wanted to touch on just quickly was the Alpha EFA. So Alpha EFA is a product I have seen Bioceuticals have it, and it is a sea buckthorn seed. So this can be useful for people that are, obviously vegetarians and vegans, things like that. It is a sea buckthorn. It's a fruit, like it's a seed, and that is a source of 3, 6, 9, and 7. So I would use this especially where there is mucous membrane involvement. So this could be people that, they're either going through menopause and they're getting thinning of like the vaginal tissue and stuff like that. That can be really useful. It sort of helps lubricate everything. Also in terms of the eye health, because you find there's conditions like Sjögren's syndrome where they tend to get very, very dry eyes, and that also this Alpha EFA, this sea buckthorn seed, is been shown to be quite useful. So generally you would do 2 twice a day with this one, but that can also, as I said, that's the sort of times that I would use that. So does that kind of make sense? And I've sort of jumped all over the place, but we sort of covered the sea buckthorn seed, which is the omega-3, 6, 9, and 7. So that's more, I'd be thinking menopause, dry eyes, things like that. You've got the fish oil and the krill oil. So as I said, both tend to be sort of quite bioavailable. The krill oil is probably better in terms of sustainability, but yes, the fish oil is richer in EPA and DHA, but as I said, because of this phospholipid membrane and incorporation with the krill oil, that could be just as readily absorbed. So both have been shown to be quite effective for inflammation and things like that. Then the evening primrose oil I'd especially consider for, once again, it could be arthritis, but definitely things like breast pain and eczema and things like that as well. So hopefully that all makes sense for you. But in terms of diets, as I said, I just want you to also think about that. Really, we shouldn't be having more than 35% of our diet, total diet, should be made up of fat. And as I said, if you get this OPOE gene checked and you're the 4-4, well, you should be having no more than 10% fat in your total diet, and that should be mainly plant-based, because they say that that gene type's more at risk of Alzheimer's and things like that. So they reckon that most of the population, that 50 to 60%, they could generally go by having, and that was the APO3 and 3 allele, so they can go by having 15 to 25% of their diet fat. So just if you're thinking about doing a ketogenic diet, I really encourage you to really just think about this and maybe get this OPOE gene checked just to see where you are.